The classification of DCIS, it is based on nuclear grade. The classification is based on nuclear grade and first we are going to discuss DCIS, Ductal Carcinoma in Situ, and we discussed that it's a risk factor for invasive ductal cancer. What kind of? Ipsilateral. It is going to increase the risk of ipsilateral invasive ductal cancer, and it can be seen in both males and females. Clear? It can be seen in both. There are important points related to pathology which are asked, that we are going to classify DCIS, and this classification of DCIS, it is based on nuclear grade and necrosis. So see the important points related to pathology. The classification of DCIS, it is based on nuclear grade. The classification is based on nuclear grade and necrosis. So we are going to divide DCIS into low grade and high grade. Now see the types. What are the types? So first is low grade DCIS and high grade. Clear? So in low grade, we are going to include cribriform, papillary and micropapillary. So what are the types included here? Is the cribriform, papillary and micropapillary. Okay. This is frequently asked in pathology also. And in high grade, we include solid and comedocarcinoma. So we are going to include solid and comedocarcinoma. Clear? Now see, lots and lots of questions are asked related to investigations. Now I want to tell you two important points. See, generally in ductal carcinoma in situ DCIS, there is microcalcification. Microcalcification is there, and which investigation is better for detection of microcalcification is the mammography. But since soft tissue abnormality is there, so if you are talking about the soft tissue abnormality, which investigation is better in detection of soft tissue abnormality? It's MRI. Okay, so two important points. What is the best investigation for diagnosis of DCIS? And that is MRI. And what is the best investigation for detection of microcalcification associated with DCIS? Then it is mammography. Why? Because MRI is having poor sensitivity for detection of microcalcification. So two important points. First, most sensitive investigation. Most sensitive investigation for diagnosis of DCIS. Then the answer will be MRI. Now see the twist in the question. Most sensitive investigation for detection of microcalcification. Clear? In DCIS. So if we want to see the microcalcification in question, this is mentioned specifically, then we go for mammography. And you can't believe both of these questions were asked in AIIMS. Clear? So you have to read the question carefully and then you have to mark the correct answer. Now see how this microcalcification looks like on mammography. So in this mammography, can you see these deposits? Clear? And the diameter is less than 0.5 mm. So the diameter is less than 0.5 mm. Can you see these? So these are microcalcification here. Clear? So you can notice. Clear? So these are what? Microcalcification. And generally the diameter of these microcalcification is less than 0.5. Now see how we are going to treat DCIS. See here, first principle, that it's a risk factor for invasive ductal cancer. So in all cases, you have to excise the DCIS. Now, the treatment depends on the size and grade, right? So see the treatment. If it is non-palpable DCIS, which is detected on mammography, so this is non-palpable, and in this case we go for excision by needle localization, and then we go for specimen mammography. So whatever the specimen is removed, we go for the mammography of specimen, and we are going to match it with previous mammography. So the treatment is excision with needle localization. We have to localize it with needle, and specimen mammography is done. So with specimen mammography. Clear? If there is low grade DCIS, in that case lumpectomy is sufficient. So excision of lump is known as lumpectomy. But if there is DCIS with limited disease or it's high grade, in that case, to avoid the recurrence with lumpectomy, what else is given? Radiotherapy. Clear? So low grade DCIS. For low grade DCIS, we go for lumpectomy. Clear? And if it's DCIS with limited disease or high grade, in that case we have to add radiotherapy also. So lumpectomy plus radiotherapy.